my name is Leizl Joy Nayahangan, and I'm a full-time senior researcher here at Keynes in Copenhagen. It's called Copenhagen Academy for Medical Education and Simulation. And I'm going to talk to you about simulation in health professions education. So my main research focuses mainly on technical simulation-based training for doctors. This is both medical and surgical postgraduate simulation-based education. I'm very involved in the whole spectrum of curriculum development, so from the basic identifying the needs of your trainees to development of the training program to choosing what educational strategies to use. Assessment it's very important in my line of work, and implementation of these training programs. Keynes is one of the world's leading academy for medical education and simulation. We are committed to increase the quality and safety of patient treatment. Again, that's our main vision, to ensure that we provide the patients with the proper care, and ensuring that our doctors are well trained, or health professions or healthcare workers are well trained. So my talk at this research week will revolve around how do we develop our training programs? So how do we ensure that we develop evidence-based, simulation-based education? Or I'm going to get you through a structured approach to development, starting with a general needs assessment. In many simulation centers, not just here in Europe, but across the world, the decision to choose what simulation-based training programs to develop, that's always the challenge, right? So most often it's based on what is available in the market, what simulator equipment is in the market. Sometimes we have somebody who's very interested in one procedure that then decides that we need to develop a training program around this, or otherwise by coincidence. So sometimes, some simulation companies, they come in and donate or lend an equipment, and then we develop a training program around that. Otherwise, so it's very unstructured. And what happens usually is that they end up not being used. So these are very expensive equipment that could end up in the corner, otherwise the basement, gathering dust, because there's no need for them. There's no structured training program that is attached to this choice of simulation equipment. So what I'm going to talk to you at the Research Week is to get you through a systematic approach of needs assessment, to ensure that the training programs that we develop are aligned to the current trainee needs. Again, as the title says, we have to start right so that we will finish right as well. One of the challenges that we face, or one of the questions that we usually get from not just our trainees, but also from key stakeholders across the hospitals, right? Is that, simulation is going to change or override or replace the traditional apprenticeship training of doctors. And this traditional approach has been there for more than a century, and it works, right? This is the cornerstone of medical and surgical training. One of the fears is that if we implement simulation, do we then say that the doctors don't need to train under a supervisor? And that's incorrect. As educators in simulation-based training, is that we really need to emphasize that simulation is not going to replace the apprenticeship training. Instead, it is an adjunct to apprenticeship training. So we equip our trainees with the basic clinical skills prior to clinical training, prior to going to their supervised training in the clinical environment. And that's one of the things that we definitely experience every time, especially in terms of implementation. So a lot of our training programs are not mandatory yet in the different specialties, and this is one of the reasons why, because there's always, there's a lot of considerations in terms of integrating this into the national or international medical curricula. I'm very interested to attend this one called Innovation in Medicine and Healthcare, from Research to Practice. And again, it aligns to what I'm doing at current. Artificial intelligence in healthcare, it's there now, right? So I think that's one of the things that I would definitely not miss during the research week.